Hi, Corey. This is your instructor, Dorinda. I just wanted to give you a quick walkthrough on the um, 3M so that you can have better use of it. You can make more use of it. When you first log into 3M, you're going to come to this first screen. It shows a box of patient information. Typically, when this is attached to the chart in whatever system you're using, it will auto-populate, except you have the ability to change the grouper. So for some insurances, they require APR DRGs. For Medicare and Medicaid and some other insurances, they require the Medicare DRG. So you can just populate in an age, make sure your dates are correct. And this will be based on the case that you're coding. Then this is the patient disposition. This means where did the patient go once the patient was discharged from the hospital. In this example, we'll just use home self-care. Patient came in for appendicitis, acute appendicitis. So we type that in here. That's number 3. You can either use the keyboard and type the number, or you can use the mouse and select the number. And we're going to say it's acute appendicitis, so option 3. And we're not going to give it any complications like abscess, perforation, or peritonitis. We'll just say it's unspecified. And that's the admitting diagnosis. So then you have to go through and code it. So you're reviewing the record and you find out, oh yes, they did have an abscess. So we're going to say appendicitis, 3 for acute, and then we're going to 1, and it's peritoneal abscess. And they did an appendectomy. If you have the op note right in front of you, you could research the op note and review it and see what needs done. We're going to assume this is an appendectomy and it open. And no, they didn't add an adhesion barrier. So this is the codes. They give you a quick view of the codes that you're about to select before you actually add them to all the rest of the codes. And I'm okay with these codes, so I'm going to continue, and then it adds them. Up here in this top box that shows up is the MSDRG. It gives you the version of the definitions manual that they're using. It's just 37.1. It gives you the DRG, which is 340. It gives you the DRG weight, which is 1.2375, and it gives you the total dollar amount to expect for that DRG weight. Now, these dollar amounts obviously change based on demographic area, so I wouldn't ever go by the pricing. I would just go by the weight, and that's typically what they'll tell you. It also gives you the same information here. You have MSDRG of 340 here, and it tells you what that DRG means. It's an appendectomy with a complicated principal diagnosis without a CC or an MCC. So if you wanted to maximize your coding, if you had a CC or an MCC, that would increase the DRG weight, and it would make sure that you're coding most specifically and not missing some important diagnoses. But you can only code the documentation that you have in front of you, obviously, and so you want to make sure that you're coding accurately. We have a resection of appendix, which is your procedure, and note both here are checked off that they're affecting the DRG. When you see a check mark here, this code affects the DRG, and so does this procedure. And any MCCs or CCs will show up in these columns. Then you have an SOI here. And the ROM, those apply for the APR DRGs. And then if you wanted to add any more diagnoses, you click here at Add Diagnosis or click here Add Procedure. You can go directly to the code book, or you can direct code it, meaning if you know the code, you just type it in. This is some demographic information across the top. It says age 45 female. This pertains to the information that's in that first screen. And it gives you the disposition. Sometimes the disposition affects the DRG, so you need to make sure that you're pulling the correct disposition from the chart. Now, up here at the top, you have these buttons file, view, options, reference, help. You can click on them and see what they have available. And the reference section is very interesting, and I'm going to actually go into it a different manner, a different way. But this help button here, you can choose one of these options here if you're interested in anything in the help section. You have the printer if you need to print something frowned upon, obviously, for HIPAA and high-tech reasons. But you have a reference. This stack of books here is your reference section. This is the ICD-9 code, diagnosis codes. This is the ICD-10 diagnosis code book. So if you can either click this code book button down here, or you can click this code book button up here. This green book is the AHA coding clinic for the CM and PCS codes. And the blue book is the AMA CPT assistant. And then you have another present on admission information there. So if you wanted to see all the resources, you can click that button. It opens up a new screen, and you have, again, the ICD-9 code book, the ICD-10 code book, and it gives you CPT code book. So if you wanted to look up CPT codes, you go in the current procedural terminology. And for the coding clinic that you use for this semester, this term, it was for CM and PCS codes. So you want to click on this little green book. And then you come across this, and this looks overwhelming. You're like, okay, how do I know where to go? What quarter? What year? What am I looking for? Now, there are two ways you can search this. You can search either with the binoculars and say you wanted to look up something for appendicitis, and it will populate in the bottom everything that comes up with appendicitis that it finds, and it's looking in the all topic groups. So we're going to look under acute appendicitis here and see what this has to say. And then we can cancel out of here. We can go back in it and look at that code selection again, or that search menu. But this says acute appendicitis, and it gives you a list. There were new codes created with all these different additions: without abscess, with abscess, without perforation or gangrene, with perforation but without gangrene, etc., etc. So then they have a couple of question and answers here for you. A patient was admitted for an emergency appendectomy due to an acute perforated appendicitis. What are the appropriate diagnosis codes? And it tells you to assign K35.32 acute appendicitis with perforation and localized peritonitis without abscess for that particular scenario. And then it gives you another question. A patient was admitted with sepsis due to acute necrotic appendicitis with generalized peritonitis. What are the diagnosis code assignments? And it says assign codes A41.9 sepsis unspecified organism and K35.20 acute appendicitis with generalized peritonitis without abscess. So these coding clinics are things that you have to follow when you're coding, and you want to make sure that you know how to find them. The only way that you know how to find them is by when you're quoting a coding clinic, you say AHACC for coding clinic, and then you say 4Q, fourth quarter, the year 2018, small p, and then the page numbers they give you. And that's how anybody will be able to look up where you're at. So if you had that fourth quarter, you're in 2018. So here's 2018 fourth quarter. And then you just click on one of these and then find the page numbers that you're looking for. And you can find the coding clinic that they were looking at if you have that information. The other way you can search for information is by clicking on this little gray book. And it's a keyword index. So if we type in appendicitis, it gives us different kinds of information at the top, and then under each one of those, it tells you the number of options. So under just appendicitis, it says 5, and it gives the 5 topics down here. If there's appendicitis with perforation and gangrene, there's 1, and you can go to it here. These buttons, this takes you back to the last screen you were at, and this button takes you forward, and you can go backwards this way. page. I think that's a page. But this displays the table of contents, and this goes to the list of coding references if you want to go back to that list. There are also other things in this list which are very helpful. There's a medical dictionary. There are anatomy plates and anatomy appendices. Clinical pharmacology drug reference. So if you weren't familiar with a drug, you can look it up. They have the AHA coding clinic for HCPCS here. Coder's desk reference for procedures by Optum with the CPT lay description. So if you weren't sure, this Coder's desk reference helps you understand what's included in a procedure. So if you weren't sure if part of a procedure was included in another procedure, you could look at the lay description and it gives you a little paragraph synopsis of what's included in that procedure. You have an anesthesia crosswalk, Faye Brown's coding handbook, we're very handy, and ICD-10 and ICD-10 PCS coding handbook. Merck manual, very informative. You can go there and look and see if something's a sign or symptom of something else. Mosby's manual of diagnostic and lab tests, dictionary of medical acronyms and abbreviations. ICD-9 and ICD-10 MSDRG's definition manuals. This is for the MSDRG, not the APRDRG. And then you have Dr. Z's interventional radiology coding reference. So lots and lots of helpful information in here for your coding needs, and reference, great references. Most of these, one book might cost you over $100 just for one of them. So the fact that you have access to this information is absolutely wonderful. If you have any further questions on how to use 3M, please let me know and I'll be more than happy to walk you through it. I hope that helps. Thanks.